Okay, so all should be quiet now. I'll be quiet.
Hi, everyone. We'll get started in a few minutes. Someone seems to have us on hold on their phone. So that's
Yeah, I hear that too.
So, yeah, I'm just going to put a message in the chat box, but we'll get started in about 4 or 5 minutes. Okay, welcome everyone to the webinar. Thank you so much for joining today. We're going to be talking about sustaining your gains for the next hour or so. We have a bit of extra time if we need it, should there be questions. We are really lucky to be joined by an E-QIP QI coach, Laura, as well as Kathy and Deb from CMHA Cochrane-Temiskaming. All three of them are very knowledgeable in quality improvement and passionate about the work that they're doing, so really lucky and fortunate to have them all with us today. Before we get into the contents, just a few pieces of housekeeping before we get going. The first is if you are having trouble with the audio or if my voice is sounding choppy to you, please feel free to use the audio phone line that's in the orange box on the screen in front of you. Before I go on, I just want to make sure that you all can hear me. Can you type in the chat box if the audio is clear for you or if you're having trouble hearing? Great. Okay, so I'm hearing that you can hear me, which is awesome. If you experience trouble, just please send us a chat message as we're working through the webinar today, and we'll try to sort out the issues as we go. If you do have any questions for myself or for the other panelists as we're sharing our experiences, please do type in the chat box as we go. We do have some time at the end to work through your questions and your comments, and sometimes it's easier just to type them as they come into your head, so please do that as we work through the slides. Just to mention to you that the webinar will be recorded and posted on E-QIP's YouTube channel for future reference, and there is a handout section on the GoToWebinar control panel where you can download the slides and the other resources that we'll be going through and reviewing with you today. And if you pull them from the webinar, they'll be on our community of practice as well. So hoping to give you some ideas and some resources as well. If you are on Twitter, the E-QIP team is very active on Twitter and posting what we're doing and who we're working with and the successes of the teams that we coach. If you are on Twitter, please feel free to tweet to us and about your QI work using the hashtag E-QIPON. We do follow that hashtag online to see what our teams are up to and what the sector is working on in terms of quality improvement. So please feel free to do that about your learnings today and anything that you think others might benefit from knowing about. So our goals for today are to learn about a little bit about sustainability theory and tips from the E-QIP team and from the E-QIP experience. We have done several webinars on sustainability before, so the theory part today won't be too heavy. There's lots of other webinars where we spend more time on the actual theory part. But today is really all about hearing from the experiences of those panelists that I mentioned previously and how they're able to and what are some strategies for sustaining gains and improvement work. The other thing that we want to make sure we get across to you today is resources. So we use a lot of different tools and papers to really guide our thinking on sustainability, and we're going to share those with you today, as well as to provide you with an opportunity to ask questions to the panelists on the phone. So I'm just going to pause here, and we're just going to introduce ourselves. So we'll start with Laura.
Good morning, everybody. I'm Laura, and I'm one of the QI coaches for the Excellence Through Quality Improvement Project. I'm happy to be here today.
Great. And I'm Jenna. I'm the program manager for the Excellence Through Quality Improvement Project. I coordinate these webinars as well as assist with our online community of practice and our ideas training.
Hi, I'm Kathy, and I do some work with Cochrane-Temiskaming in the area of process and the documentation. And it's really great to be saying hi from Northern Ontario.
And I'm Deb Pultz. I'm from CMHA Cochrane-Temiskaming, located in Timmins. I'm manager here of Case Management Services, and Kathy and I basically our co-leads for the E-QIP project that we're still involved with. And I'm very glad to be here today as well.
Great, thank you so much. We'll hear from everyone a little bit later on. But before we get into the theory part today, we just wanted to ask you how many people are with you today and what organization you're representing. So if you could take a moment to type that in the chat box, that really helps us understand who we're getting through with our webinars, as well as how many people are joining. So I'll give you a minute just to do that. And as you're letting us know where you're from and how many folks are joining today, we just wanted to review who E-QIP is and what we do. I'm sure many of you on the line are familiar, but the Excellence Through Quality Improvement Project, or E-QIP, is a partnership between Addictions and Mental Health Ontario, CMHA Ontario, and Health Quality Ontario. And our role in the system is really to help build the capacity and the motivations of providers working in community mental health and addiction to use quality improvement methods and tools, understand them, and to apply them to the services and programs that we offer, so that we can continuously improve the care that we're providing to the clients accessing this sector. We do that through a variety of ways. We do that through coaching teams within organizations to work through a quality improvement project, as well as we have an extensive training and education program, and we also have an online community of practice that you'll hear more about at the end of the webinar. So this is how we define quality improvement. I won't read line by line what the definition is, but essentially quality improvement is all about looking at the systems that we're working in and supporting healthcare providers to make changes that will improve outcomes for clients as well as experiences for those accessing care in our sector. And it's really all about making sure that healthcare professionals and administrators in the field have the tools and supports they need to give the best care possible. And these are three models that the E-QIP team uses to talk about and view quality improvement. They are fairly common across all healthcare sectors in the province of Ontario as well. I'll start on the right-hand side of the screen. The quadruple aim is really what we're striving for. So we're striving for better health for the population, better care for individuals, improved provider satisfaction, and lowering costs through improvement. And in order to do that, we want to make sure that we're looking at the domains of health in every quality improvement project or initiative that we're participating in. So the domains of quality are really all about what makes up a good quality healthcare system. It's care that is equitable, it's timely, it's client-centered, it's efficient, it's effective, and it's safe. So the way that you can view these domains of quality is that every project or initiative that you're working on should really nicely fall into at least one of those domains, and that way you know that you're really working towards higher quality of care for the people that you're serving. And the very last model that we use is the model for improvement on the left-hand side of the screen. The model for improvement is really all about the how. So how can we actually impact the domains of quality, and how can we reach the quadruple aim in the services that we're providing? So we'll talk a little bit more about the model of improvement as we get going, but essentially it's a series of questions, and there's tools and templates associated with that model that help us actually do quality improvement work. So today is all about sustainability. I have mentioned before that we have done a few webinars on this topic in the past, so we're going to go over just some brief theory about sustaining gains in quality improvement projects, and then we'll hear from experiences on the ground. We did want to have more conversation-based webinars today, so hopefully you'll appreciate that as we work through our conversation today, and it'll hopefully give you some ideas of how to sustain improvements that you're seeing in your projects and your initiatives. So this is the model for improvement in a little bit bigger, so you can probably see this more so than the slide before. The model for improvement really asks three essential questions. So the first one is, what are we trying to accomplish? The second one is, how will we know that the change is an improvement? And the last one is, what changes can we make that will result in an improvement? And then the model for improvement is really strongly advocating for really small tests of change through plan, do, study, act cycles, or PDSA cycles, where you test your solutions or your change ideas on a really small scale before ramping them up and saying, this is the way that we're going to work from this point forward. And so the model for improvement, if you've joined our webinars before, you know very well that there's a bunch of tools and resources available to you to help answer these questions and to help conduct PDSA cycles. But I think it's important at this point and with this webinar to really let you know that the model for improvement is all about how can we make changes that will actually last and make an impact and will motivate people to change and to change in the long term. So these are the fundamental principles of the model for improvement. They really allow us to understand kind of what the model for improvement encourages us to think about as we're working through service and program improvements. The fifth principle here is all about knowing when and how to implement a change and to make it permanent. So when we work in the model for improvement, there's a whole, what we like to think about is, you know, right from the beginning of a project, why is this important? How can we get buy-in early on so that the changes that we make will be sustained in the long term? So what is sustainability? So sustainability is really all about, once you've worked through understanding what your issues are and coming up with some change ideas that you feel will actually impact the change that you want to see in your service or program, once you've actually seen improvements on your outcomes, how can you actually hold these gains in the long term? And so on this slide, there are 6 kind of key factors that you'll hear a little bit more about later, but that are really important to making sure that we can sustain improvement. So the first one is all about supportive management. And this can be things like senior management and organizations communicating why a certain quality issue is of importance to the organization, as well as some leadership in celebrating successes as you see them in your improvement projects. The second one is about error proofing, and this is all about making it either hard for people to go back to the old way of doing things or impossible for people to go back. It may also include some activities like training or updating resources, updating training materials so that people are aware of the changes in the long term. The third one is about feedback systems, so making sure that there are good, clear feedback systems available for people to understand what improvements have been made and if they're being sustained, as well as assigning some accountability for those feedback systems so that someone is monitoring the outcomes in the long term. The fourth one is about shared sense of systems to be improved. So this one is really all about understanding or making sure that people understand how they're contributing to improvements and that everyone feels part of the team and that they have a role to play in QI. The second last one is all about engaging staff. And so this one is about, from the beginning of your QI project, how can you be engaging staff and encouraging people to share their ideas? As well as the culture piece. So this might include actually including QI as part of people's job descriptions and making sure that people feel connected to everything that's going on regarding improvement. And the last one is formal capacity building programs. So this one speaks to the importance for an organization to really make sure that staff are aware about quality improvement methods and tools and have the skills and abilities to actually use them effectively in their practice. And so this is kind of a summary of the key pieces to sustainability. So sustainability usually involves standardization, documentation, measurement and review, so that ongoing feedback piece, as well as training and education of staff on quality improvement, but also on implementing change ideas. So I'm going to pause here and we're going to launch a poll. And we're just interested in knowing who's on the line today. So we're asking you, are you currently leading or part of a QI team? So I've launched the poll, so if you could answer either yes, you're leading the QI project, you're part of a QI project team, or no, you're not, but you're looking forward to starting. Okay. So I'll share the results. So you can see that 29% of you are actually leading quality improvement work, 59% are part of a QI project team, and there's 12% that are not working on a QI project but would like to in the future. So hopefully this webinar, for those of you leading the QI project, this will give you some ideas on some strategies that you can use and take back in the work that you're doing. If you're part of a QI project team, it's again hopefully giving you some ideas on ways that you can contribute to sustainability. And if you haven't started working on a QI project but would like to, I think this webinar will be really important for you because we often encourage people to be thinking about QI right from the beginning of a project. So hopefully there are some takeaways here that you can use as you start your QI work. Okay. So these slides are fairly repetitive from the principles and the factors that I've already gone over, so I won't go through them in detail, but I will flag for you that these are some really great questions to think about at all stages of a QI project. So right from the beginning, revisit these questions in the middle of a project and think about them when you've seen change and you're thinking about how can we make sure that these gains are sustained in the long term. These questions are really useful for you. But the one that's a little bit different on this slide is the need to communicate the benefits of the improved process. So this is really important, again, right from the beginning of a project. For those that may not be working close with the project but will be responsible for changes in the long term and may be asked to make some changes to the way that they're providing care or supporting care, it's important right from the beginning that people understand why this is an important issue to work on, what's their role in this project, as well as what are the successes that you're seeing to motivate people to continue to change and to test the change ideas. This slide, similarly, a little bit of a repeat from some of the other slides, but some good questions for you to use as a tool as you're thinking through sustainability. One of the questions I wanted to flag here is the improvement or change flexible and able to respond to changes in the environment? So the model for improvement really encourages us to test change ideas in a variety of different settings with a variety of different providers and with a variety of different clients as well. So when you're thinking about sustainability, when you're getting to the solution phase of your QI project, it's really important for you to think about how can we test this idea under different conditions to make sure that it's working the way that we want it to. And the next two slides are just really key overarching principles that we encourage you to think about when you're coming up with solutions that will hopefully allow you to sustain those gains in the long term if you're experiencing actual improvement. And so this one is really getting you to think about low to high leverage change ideas. And the theory here is that we really want those high leverage change ideas that, again, make it almost impossible for people to go back to the way of doing things. And I think something else that's important to note when we're thinking about these three buckets of change ideas is that the low leverage ones are often really important. So things like changing the rules and policies and providing education and information. They're often really important for improvement projects, but we encourage you to think about, after the policies have been changed and you know that the idea is working, after you've provided education and capacity building to the staff to make sure that they understand the change ideas and the impact that has on client care, it's important to then go beyond that and think about how can we make things simpler for people, what are some reminders or checklists that we can put in place so that after the training happens, there's actually processes in place that that will allow for people to be reminded of what they were taught. And the second principle is that the higher people perceive the value of the change idea that they're being asked to test out, and if that change idea actually reduces workload or this workload is about the same, you'll have a higher degree of success for sustaining the changes that people are being asked to make. So just flagging that when you're looking at change ideas, it's important to understand how people perceive the value of that idea, and you won't add to people's workload. So I'll just go through these slides very quickly, and then we'll actually get to the tools and discussion part. The next few slides are tips about changing or how to hardwire changes into your practice and into the providers that are being asked to change the way that they're providing care. So there's things like assigning responsibility for your project in the long term to make sure that someone's monitoring the success in the long term, again, to hopefully sustain the improvements that you're making. Making sure that there's a standard work process in place. So making sure it's really clear, what the new process is and that everybody understands it. Again, thinking about testing your change ideas under a variety of conditions before you actually say that this is the new way that we're going to be working, as well as using things like run charts to show change and improvement over the long term are all some tips that you can take forward with you to make sure that the gains that you're experiencing are sustained in the long term. So I'm going to pass things over to Laura, and she's going to go over the NHS Sustainability Guide.
Great, thank you so much, Jenna. What I wanted to just demonstrate over the next couple of slides is the sustainability guide that we have been using with our project teams in their work at their organizations. And this model, it's a diagnostic tool that has been developed by the National Health Service, and it's used to predict the likelihood of sustainability in capturing all those pieces that Jenna has been talking about at the beginning of this presentation and this webinar for the improvement projects that you're working on. And it's off to the side in the handout section. You'll see several different resources attached there. And you are welcome to download those and take a look at them as well. There's a link to the website there with regards to the guide. I'm just going to try to advance the slides. There we go. There's a bit of a delay. Sorry about that. In the sustainability guide, you can read the guide and get some more granular details, but there's a questionnaire that's completed within the tool, and you end up with a sustainability score at the end that shows you where the strengths are for sustainability at your organization related to your specific improvement project. And it also flags areas of improvement within the context of sustainability. And there are three scores that are produced related to these three areas around organization, staff, and process. And within the organization, the things that we're looking for is pieces that are related to infrastructure of the organization and fit with the organization's strategic aims and culture. So how does the project align with the strategic aim of the organization? We have organizations that have strategic plans, quality improvement plans. Does this particular project align with that? From the staff side, we have levels, different levels of engagement that you would want to pay attention to during your improvement initiative. You have your clinical leadership engagement, your senior leadership engagement, and your staff involvement and engagement in the process that you're trying to change, and what behaviors they have. The sustainability guide shows us this is one of the factors that you will notice, and it basically asks you to choose the factor level that best describes your situation, and then you tick it off, and it gives you a score at the end on the last page. And as we've been coaching project teams, we have had our own learnings that we have observed, and we just wanted to share some of those with you because I think it's really important to get that experience and maybe inspire you to take a closer look at your own sustainability of your QI work. And as mentioned before, sustainability of QI work does have a lot to do with organizational culture. And the wider spread the improvement culture, the higher likelihood of the projects being sustained. And so paying attention to that piece as you're working through your project would be really helpful. Improving board capacity and leadership understanding of their role in advancing the quality agenda. The sector has they're starting to onboard through quality improvement agenda. And there's been people have been telling us that they need that board and leadership understanding of what QI means for them and their role in that from the perspective of sustaining the project. And then the E-QIP team, we've been encouraging teams to complete the sustainability assessment at the outset of the project to give them a sense of what things they need to pay attention to, what strategies they need to implement from the very beginning. To avoid their project kind of laying flat at the end and not really moving forward past the end of their project work. Some of the other learnings that we've had, experiencing a delay here, sorry about that. So in cohort 1, the E-QIP team reviewed sustainability scores on the NHS tool and noted that for those least likely to sustain, organizational enablers seem to be lacking. So those are alignment and infrastructure. Most of the teams in cohort 1 that completed the tool identified that infrastructure for sustainability was an area for development. We also observed that when we were teaching or coaching others through QI, it is really important to start talking about sustainability right at the beginning of the discussion. And again, it also helps to share information with staff and getting them engaged in the process. It also helps them to understand or increase the perceived value of the project. And then at the end of our coaching support, which is about 5 to 6 months of working on a QI project, teams reported continued support was required to ensure sustainability. And we all know that this kind of work has been really challenging with the resources that we currently have. I'm going to pass it over to CMHA Cochrane-Temiskaming, which is a team that has been part of our E-QIP coaching support since cohort 1 started. And it's been really lovely to be able to participate in this journey with them. And I'm looking forward to hearing their presentation and how they've used the sustainability tool in their work.
Okay, so greetings from CMHA Cochrane-Temiskaming, and a shout out to the E-QIP team because they've been really helpful to us as we've moved forward on some of our projects. Next. So I put this slide up here to demonstrate one of the first strategies that was really helpful for us when meeting with our E-QIP coaches is we have implemented a documentation strategy. It's a domain-oriented recovery record. It starts from the moment the client phones or walks through the door until graduation. And the E-QIP committee suggested to us, why don't you focus on one small aspect? So we decided to focus on the recovery plan. And I'm going to speak to that over the next few slides. Next, please. So this is a slide that we developed after we initiated our first change item, and it's really helpful, or we believe, to have a one page that you can share with staff, managers, board members, others, to sort of demonstrate what you've been working on, what is this project. And so I'm not going to go through this in detail, but you can see in the upper left-hand corner the same diagram that I showed you on the previous page. In the bottom left-hand corner, we've identified quality dimensions because we want folks to realize we're always using a QI lens. And then when we look at our baseline data, you can see that 100% of clients found the recovery plan helpful, which is wonderful, but guess what? 45% of our clients don't have a recovery plan. So that was back in 2016. And so we used all of the tools from the model of improvement. So we got to the point where in 2018, 90% of our clients have a recovery plan. And so then we went from, okay, our clients have a recovery plan. What's the next step? Well, the next step is, are we reassessing the OCAN and updating the recovery plan? And the last two items I'll share is, so some of our change ideas are thrown in there. There's a postcard for clients and staff to just help them understand the process of assessment plan and review, and then bookmarks that we made for our staff to help them with the recovery plan. And so then, as of January 9th, 2019, we're now peeling back the onion a little bit and looking at the larger process of documentation. So I'll ask for the next slide. I put this in here, not that you need to read it, but just to say one tool that we have found helpful is a project charter. And sometimes we move forward with change ideas and we haven't gone back to a project charter, which is one of the tools from the model of improvement, to really zero in on what's your problem statement, what do you hope to accomplish, and how are you going to measure it. So I don't expect anyone to read this, but I just wanted to say that's one thing or tool that we think about at the very beginning, and then we sort of put it to the side, and we found that it's helpful to go back and look at that. Next slide, please. The PDSA model, I'm just going to speak to that for a minute, because that is a lexicon that has been permeated throughout the organization. The PDSA, the Plan, Do, Study, Act. In fact, one of our client advisors said, well, the recovery plan's a PDSA. Why don't you call the recovery plan a PDSA? So we, a statement like that helps us know that we are getting into this thinking where we plan, do, study, act. And so a quick example is for the recovery plans. I gave you the stats on how we had 100% of our clients thinking the recovery plan's great, but 45% don't have a recovery plan. So then we came up with some change ideas using many of the tools that were introduced to us through our E-QIP coaching. And then we went back and looked at our data. And so we started collecting data on a monthly basis, because the issue wasn't the clients not finding it helpful, it's that not everyone was doing recovery plans. So then we collected that data. We got our numbers up to 90%. And one would say, hallelujah, that's great. But under ACT, our data also showed that while some people are doing recovery plans, they're not valuing them. So clients are valuing them, staff may not be. So we had to adjust our plan and go back and see, let's spend a little bit more time exploring recovery plans and how and why clients find them helpful. So that's the PDSA model. And the next slide. This is comparing our scores from 2017 to 2019 on the sustainability tool scores, and I won't go through all of them. And you can see in some areas, for example, infrastructure for sustainability, we haven't moved forward as much as we'd like to. Unfortunately, we don't have a full-time QI position. We don't have a QI position, but different folks throughout the organization have taken that on. But so that's one area where we may be struggling a bit. But some areas where we've made some improvements is fitting with the organization's strategic aims and culture, and Deb may speak to that later, but really ensuring that QI is part of the strategic aim of the organization. So that's been an improvement for us. Senior leadership engagement, and we've really seen an improvement in that area. And we just had an all-site tour to our different sites, and our senior executive member came to every single one of the meetings, stayed for the entire morning, didn't sort of slip in, slip out, and so we're seeing more engagement in that area. Moving on to credibility of the evidence, and that's one area where we've really grown to realize the potential of collecting both quantitative and qualitative data, not just from clients, not just from staff, but from the organization, and really trying to get as much of a 360 picture as we can. And lastly, benefits beyond your patients, and I would say our clients, and definitely we're hearing from new staff or staff that have maybe come from other programs. It's helpful to have some of the supports that we've developed along the way. So I believe that is my last slide, and I'll move it on back, I believe, to either Jenna or Laura.
Hi, it's Laura. Thanks so much, Kathy. That was great. And
Laura, can I interrupt for 1 second?
Yeah.
I'm really remiss. I have to put a big shout out to Deb Pultz. She has been instrumental in many of the changes, or touched all the changes that we've been working on at Cochrane-Temiskaming. And is there anything you wanted to add, Deb?
No, Kathy, thank you for the kind words. Can you hear me?
Yes, perfect.
Oh, okay.
Yeah. Okay. I should be saying
that's great. No, you got 100% buy-in from me. I'm was excited to return to this position and carry this out after the other manager retired.
Okay, now on to you, Laura.
Okay, that's great. Thanks so much. And really, this part of the conversation is going to be kind of, I'm going to ask a few questions, and then I'll leave it to yourself and Deb, Kathy, to answer the questions that related to your project and the sustainability tool. And hopefully you will inspire others in their work with this discussion. So the first question that we have for the two of you is, can you describe how senior leaders and management played a role in your improvement project? That's the first part of the question. And the second part of the question is, what impact did that have on managing and sustaining your change?
So it's Deb, and I can answer that. I think we've been very fortunate to have a great senior management team who wholeheartedly believed in this endeavor right from the start. They played a huge role in terms of supporting Kathy and I to be co-leads, and then as well provide the time and money for staff and clients to get the E-QIP training, etc. They encouraged us, gave us direction, supported us to move forward in the project, and I can't say enough about that. Even covering the travel costs, we had to go to Sudbury, to do the E-QIP training and stuff, and they paid for the clients as well. And without their support, I can tell you, it just wouldn't happen. And they certainly know. They let the organization know. They have senior management has quarterly check-ins, so they go to all the sites, and during that time, they certainly talk about the work that Kathy and I do. They let people know that they support it. They encourage people to get on board, And I think Laura said earlier, we've been at this for a while. So in terms of being able to sustain this, again, I think if we didn't have that backup and that support from the senior management, we wouldn't be where we are today.
That's great. And, you know, I am always impressed with the support that your organization has provided, the leadership of your organization has provided. And, you know, it does speak to the success of your project and still moving forward as you move through these next few months.
Thanks.
Okay, so the second question that we have is, how has your QI project tied into larger organizational goals?
So we've been looking at how to improve client services and as well as accreditation now for some time. So it actually tied in very well. In fact, two of the three strategic directions that our organization is aiming for is wrapping high quality services around those we serve and leveraging quality improvement for impact. So you see it fits very well. We're constantly looking at how we can improve our overall services while including direct service workers as well as clients at every opportunity we get. Yeah.
Okay, so question number 3, how has measurement been used in sustaining your improvement project?
It's Kathy, and I can respond to that one. We have really ramped up our focus on measurement, and we've done that both from client perspective, staff perspective, and organizational stats. And so we're really trying to get a wholesome or fulsome picture of where we sit currently, and knowing where we hope to go, and following the numbers and following the qualitative data. So, for example, I talked a little bit about the recovery plans and how we move forward with that. So now we've peeled back the onion a bit more, and now we're focusing in on intake as that leads up to the recovery plan, or the completion of an OCAN and the development of a recovery plan. And so it's been really helpful for us to collect data from clients, hearing what they want in their words through emotional mapping, but also through anonymous survey. So those pieces of information, and then meshing those in with data from staff and from the organization. So it's been really helpful in showing numbers, and we just met with senior executive yesterday, and I'm just going to throw out one number here, but we have wait times going from 264 days down to 24 and on average. And when you show that on a graph, it's impactful. So measurement has become pretty important to us.
Yeah, so it's not only, the measurement is not only informing you as a project team, but it's also being used as a communication tool external to the project to share not only with your staff, but also with your clients. And I like that. And I like that you're using the recovery plan as that qualitative data to give you that feedback as well.
Thanks.
And then for the fourth question, how have you engaged staff to keep momentum up for your QI initiatives?
Well, I think I'll look at it from the perspective of the E-QIP committees, and then maybe Deb, you can speak to specifically to staff that are involved in projects. Okay. But I think a few things. One, we have a consultative approach. So we have our E-QIP committee, since 2016 actually, our E-QIP committee meets every 2 weeks. We continue to meet every 2 weeks. Of course, we may have a bit of a hiatus in the summer, but not always. And we have great attendance. So it helps us know we must be doing something right. We're really, what's critical for us are our client advisors. They are there every step of the way so that we don't lose the client's perspective. And I think that's helpful for engaging staff to hear what clients have to say. And so we're following the process, and I think that's really helpful. And right now we're balancing that, like, that fine line between trying to action items because folks want to see things happen yesterday, and then following process. So I think that's an area that we're working on right now. And so an example would be we're piloting the intake process at one site, and all 3 sites would like to do it, but we're really trying to hang on to some of those to the principles of the model of improvement, but at the same time engaging staff by allowing them to see that we are moving forward, we are listening to what they have to say. And I don't know, Deb, did you want to build on that?
Yeah, I guess from a team perspective, I've been managing the team now for almost a year, I guess. And I guess getting back to buy-in, because I guess some of the challenge before the other manager retired is I'm not sure that she was quite, she was on her way out, and I don't think she was quite as involved in the whole process, and so that's what we were getting from the staff too. I don't think they felt it was all that important at the time. So again, I think it's imperative that the manager is engaged and has buy-in. Otherwise, I think the chances of the team buying in are slim, really, and I think that goes without saying. So anyway, I effected changes, but I involved the staff in the process. I got their feedback and input, and some of the changes included having meetings every Tuesday with them, and we'd review all the referrals together. I think the previous manager just sort of handed out to people and said, here, you do this and you do that, and there was never any buy-in, there was never any connection, there wasn't so what we do now, we actually go through the referrals. People get to see, is it a younger person, older person? People have their preferences in terms of who they feel comfortable or who they like to work with. Some people, want to work with people who have high anxiety, for example. So we try to make that fit, because I find that makes, obviously we provide a better service that way. And the other thing that they do is they'll take on the intake and do the screening if it is a person that they feel that they'll want to work with later when they can, and they'll take them on. And they can take them on either during the intake process, or they can take them on a little bit later on when they have time. We don't have a wait list right now, so this has been working very well so far. And we also have monthly huddles with the pilot team, and that's about once a month. And Kathy tunes in, and we just sort of check and see where people are at, and we provide updates. And if there's any questions or concerns, then we might go through those. We have focused half-day meetings as well, and Kathy comes up for those, and we find those very helpful. The more staff learn about it, I think the more excitement we could generate. And I think as we've gone along, like what I see now in terms of our atmosphere and our culture is quite a bit different than what I was sort of witnessing before. And I think the fact that we went from approximately 75 people on the wait list when I came on board to 0 in about 5 months' time really created a lot of excitement for the staff, because they saw it could be done, and they it was a trial. Let's try these meetings. Let's do it this way and see if it works. So far, it's worked very well. So there's no reason to believe why it shouldn't continue to work. But it's something that we definitely will continue to monitor and tweak if we need to. But that's about all I have to add with that one.
Great, thanks so much. And I think what you're talking about, Deb, when I'm hearing you talking about your role, is that you're not talking about it from the perspective of management, that you're talking about it from the perspective of leadership. Mm-hmm. And I think that's a really key piece, and that you're not there to tell people what to do. You're inviting mm-hmm. them to tell you how we can do it better. And so I think that's really important. And Kathy, to your point about, you were saying you have biweekly meetings since 2016, and having good attendance at that. And I think that's really important is what's happening during those meetings and involving the service recipients and your clients as part of the advisory group to your work. I think as a frontline staff person, that would be really empowering to have that person working alongside you and hearing their story and their voice, and I think that would motivate a person. So thank you so much for sharing those. I think there was a lot of tidbits and golden nuggets within that answer to that question. So very, very nice. And the fifth question. Go ahead, Deb.
Well, I was just going to say, like, the leadership and coaching, like coaching for sure. I mean, and especially in this day and age, right? Things have changed a lot. And the more that you can sort of be an ally or an equal and work together, I think you stand a far better chance to make the changes that you want and at least have that eagerness or that willingness to support that, right?
Yeah.
Yeah, good point.
Yeah, really great. And then for question number 5, which QI tools have been the most helpful for your project during your QI journey and that have helped you, with sustaining your gains?
I'll answer that, and I like to stick to the number 3, but I might give 4 examples here because I'm going to use the project charter, and I think it's something that we forget about. And we was talking about Cochrane-Temiskaming, and I'll take responsibility for that too, to bring us back to the project charter. And even if we don't pull up the whole project charter, to ask ourselves, what's the problem statement? What are the aims? What are the outcomes we're looking for, et cetera? And that really provides us with a blueprint. So that would be one. I think the driver diagram is really helpful. So one area that we're, when we go back to our driver diagram is to recognize that you might have, if you recall one of the previous slides I showed, we had bookmarks for staff, we have postcards for clients, but what we're missing is the supports for the supervisor, and that was in our driver diagram. So we've gone back to that, and that's an area that we're focusing in on right now, is how can we support supervisors. And then I think the PDSA, just that slide where I showed that model, it's simple. Everyone understands it, and so that in itself, I'll say, is a tool. And lastly, the emotional map. I think it's been helpful to learn how to measure the client's voice or the staff's voice. And I think those would be the top picks, I would say. But I will add that we've used them all, and they've all been helpful. But if I had to pick the top, those would be the top.
Thank you, Kathy. And I think, for me, as a QI coach, I've always really enjoyed and found helpful the driver diagram because you can see at a glance kind of the logic model behind your project. So from the aim all the way over to the change ideas. And then you also have the measurements attached to that, which can help guide you and kind of keep you focused as well. So thank you for listing off those really great tools. And I also, of course, I'm very passionate about the use of the experience-based design methodology in quality improvement work and inserting the client voice into that. So really happy to hear that was also impactful for you.
And Laura, just a shout out, because when we had our last meeting with you and we were talking about our change idea, and you said, oh, where's your project charter at, right? So for folks out there that haven't worked with the E-QIP project, that's why it's helpful to have a coach to sort of, just give you a little reminder, hey, where's your project charter at? So I just thought I'd give that as an example of how coaches are helpful.
Thank you. So question number 6, what data might you continue to measure past the project end date?
Okay, well, I think we're going to be collecting more data than we have all along. I think we're really seeing the benefits of collecting the data. The data from the client, because we make assumptions on what clients find helpful and what they need. And I think collecting data from clients, both anonymously through quantitative and qualitative data, has been really helpful for us. And we plan to continue doing that. In fact, after this E-QIP project ends, we're still planning to go to the various sites, and actually our client advisors are taking a phenomenal lead in those in facilitating the sessions. So definitely collecting data from our clients. We're going to continue with collecting data on OCANs and recovery plans, but we really slowed that down once we hit our number, and our staff were actually manually collecting the data for us. We're now working with CRMS to collect that by a click of a button, but then we decreased that to every 6 months, and then we're moving forward to collecting other types of data as our projects change. And really additional data, we've just started really looking at data that we can collect from the CRMS platform as to intake times, the length of time between entering into the system and the first OCAN being completed, all those sorts of things. So if anything, we're going to carry on collecting our data and expanding our knowledge of how to best collect data and how to best share it so that it paints a picture for folks on directions that we're taking.
And I think what you're also saying too, Kathy, is that as your project has progressed, the data that you have been collecting has been changing based on what you've found out.
Correct.
Yeah, and I think that's a really important piece to, you got to keep your eye on the big dot and measure that piece. But as you move through your project, your measurements may change based on how your project has kind of morphed, because they do morph.
And the other thing I would just add is every time we do a recovery, so we're not just collecting data on service delivery, we're now making sure we collect anonymous data and have some discussion either through facilitated cards, whatever, on the changes themselves. So if we're going to have a recovery plan workshop, what was good about it, what wasn't, the bookmarks, what's working, what isn't, and the postcards. We had, I think, 44 clients anonymously respond to the usefulness of the postcards, for example. So we're learning as we go what data is most helpful and how to best portray it. And thank you to E-QIP for encouraging us to do that, because that's one area I think we've really grown in.
Mm-hmm. And one of the things I always tend to talk to teams about is it's not about taking the data that you already have and trying to make it fit with your project. It's about finding the data that has meaning for your project and to help you, because I think a lot of people get stuck in those generation of those massive reports that we have to do to the ministry and trying to find the meaningful data within that. But it's really about searching out what your meaningful data is for your specific project. Question number 7, for projects involving multiple sites, which yours is, how has that, or how will this impact sustainability, and more specifically, spread?
So our E-QIP team right now, we involve managers, staff, and clients from all sites. And so we have that representation. We meet every 2 weeks, probably for about 2 hours roughly. And it's usually via like OTN or GoTo meeting. We have had full day meetings in person, usually drive up to Kirkland Lake, because that's sort of the central meeting point, and where we have a lot of work to do and we can get a lot done in person. But most of the time we were able to use our OTN, I find that it's had a very positive impact because it has enabled us to sustain and spread what we determined to be best practice, basically. So we continue just to grow and monitor, observe progress throughout the organization, and one of the ways we've done that is through the number of OCANs that are being done monthly. I go back for 6 months at a time, and in this particular case, I looked at September 2018, where we had 31 OCANs uploaded to the IAR. October, it constantly went up. So October, we went up to 39. November, by then, it was 45. December, we had a bit of a drop to 41. I don't know if Christmas holidays had anything to do with that. But by January 2019, we're up to 55. So as you can see, we are able to sustain and progress, which is absolutely awesome. And like I think Kathy alluded to earlier, when we started the project, only about 50% of staff were completing the OCANs, and now they're all completing OCANs. They may need some nudges here and there, but and they're doing the recovery plans as well. So after they're finished the OCANs, then they do the recovery plans based on the information that they've retrieved. So the only sort of challenge, and I think Kathy might have alluded to that too, is sites are eager to get going on this too. They see what we're doing. They're basically chomping at the bit, and we're just saying, just hang tight. Let us get more data. Let's just see if finish our plan to study act items and see how it works out, and we'll let you know. So, but I mean, it's not a bad problem to have. If people are eager about getting going on it, that it can only be good.
And I love that you've the hang tight part, because I think it's really important from the sustainability of a project to not spread too soon. And make sure that the product that you are in the new process, the new way of doing things is going to work for everybody. So yeah, I was really happy to hear you say that.
No, thank you.
I think Jenna, you had another question that you wanted to ask. Do we have time?
Yeah, I just, I know before we started today, Kathy and Deb, we had talked about challenges that you had, and I know that you had mentioned some, but I just wanted to give you the opportunity to either talk about some that you missed or anything that you think people might be interested in.
It's Kathy. I might have alluded to this, and I can't recall if I mentioned. So I think, so if we look back to our original changes we made and our original problem, it was the recovery plan. And of course, in order to complete a recovery plan, it's helpful. It's not necessary, but it's helpful to have an assessment, the OCAN. And so just recently, so I mentioned we stopped collecting numbers as often in the format that we were doing. I know Deb just gave some numbers, but in the format that we were doing. And so we just did a really quick and dirty survey of staff about the OCANs. And so while our numbers are up, the valuing of it is still not where we'd like it to be. And so, that really is a challenge for us, because we don't want folks completing the OCAN because it's a checkoff. We want some understanding of how that can be of value to the client. So that's one of the change projects that we need to, it's on our bailiwick, but we're not there yet, is to go back and explore how we can work with staff to see what are the glitches where they're not valuing the OCAN, and how can we support staff. So I think, it's 2 steps forward, 1 step back, but I think it's important to step back a little bit and still collect data and see where you're at, or listen to client's voice. And I think the other challenge is that everybody is an individual and they approach change differently. And so we've really started using the analogy of the cat and stretching, or I have anyhow. We're encouraging staff, you know, do you want to take a big stretch or a small stretch? What kind of stretch do you want to take, and how can we support you along the journey? So those would be two that areas that we're working on, because, you know, to say that we have 100% on board, jumping up and down excitedly is not always the case, but in different aspects of the project, yes, they are. But how can we support 100% of the staff in moving forward?
Yeah, you're absolutely right, Kathy. I mean, the stats do look good for sure, and but I know for a fact there's people just going through the motions, and I mean they're quite clear about it. They don't, and we're just talking about one or two, but they just don't. I don't know what you can do, but they just haven't bought in. They don't see the value of it, but it's a work in progress, and you're right. I think as we continue the project, that's what we have to do, is start trying to dig a little deeper to find out what the issues or the barriers are, or the block, I guess, as to what it is, or why it is they don't see it as a value. So we'll keep trucking.
Great, thank you both. So we're just going to wrap up here. If you do have any questions for Deb, Kathy, or Laura, please feel free to type them in the chat box, and we'll try to get to them in the next 7 or so minutes. So while you're doing that, I'll just note for you that we do have some resources for you on sustainability for you to look at after today. Some of them are in the handout sections, and all of this will be emailed out to you either this afternoon or tomorrow morning. But those are just some resources, webinars, IHI papers, and tools and templates that you can use to help you in sustaining your QI work. And if you don't have a question, we'd love to hear what strategy you heard today that you're looking forward to trying with your team. So if you can type that into the chat box, that just helps us know kind of what the interest is from the folks on the line today. So please take a minute to do that as well. So while you're typing in the chat box, just a few items for you. The E-QIP Community of Practice is our online portal for resources, as well as to have discussions with people in the community mental health and addiction sector on quality improvement. If you're not a member of it yet, I encourage you to sign up. More instruction will be forwarded to you in the follow-up email as well. But we do encourage you to sign up and to ask your questions and to engage with everyone online from across the sector and across the province. There's 3 upcoming webinars from QO and the Ideas team. 2 of them, one's coming up fairly quickly on Measures Part 1, and then the second part is on using measurement for improvement, as well as an interesting one on personal resilience in times of change. And with the given healthcare system restructuring, I think that one is really important for all of us to attend. There's also 2 upcoming conferences. The first one is CMHA Ontario has their conference on quality coming up on April 1st and 2nd. More information or to register, you can click on the link on the slide. And the Addictions and Mental Health Ontario Conference is coming up in May. And again, more information can be found if you click that link, as well as registration information. We do have quick QI webinars on our YouTube channel for you to view at any time if you need a refresher on the model for improvement and the associated tools that we work with. For those of you on the line that are a bit newer to QI, there might have been some tools that you heard about today that you're not quite familiar with. And flip through those webinars to learn about the model for improvement and some tools that can help you understand your problem better and come to meaningful change ideas. So this is part of our monthly webinar series, the webinar that we've provided to you today. We've had lots of them over the last couple of years, and the ones on this slide are ones that are fairly popular and will help you in your QI journey. If you're not part of the newsletter, we do encourage you to sign up. You can get some updates from the E-QIP team, upcoming trainings and education sessions, all of our upcoming webinars and resources that we have to offer are included. It comes out twice a month, and then sometimes we send out some communications if we feel that something needs to get out to the QI folks in the sector. This is the contact information for the E-QIP team, and we're happy to help and answer your questions at any time, so please feel free to do that. And I wanted to first thank Kathy and Deb for joining us today. Both of you are very supportive in sharing your stories in QI, and that this isn't the first webinar that you've helped out with before. So just really thank you for sharing what you've been learning and for sharing it with others. It's really appreciated, and your story is definitely worth sharing. And also thank you to Laura for your moderation and your active listening, and that was a great discussion that you led today as well. For those of you that are still on the line, please feel free to fill out our survey. It's a few questions that shouldn't take too long, just to let you or us know about your experience on the webinar line today. And it helps us improve our webinar series, as well as get out some ideas of what you're interested in learning about. So that's it. I don't see any questions coming in, but if you do have anything that you think about after you get off the line today, please feel free to reach out to anyone on the E-QIP team, and we're happy to assist you. Other than that, please look out for the follow-up email with all of the resources from today, and thank you all so much for joining.
Thanks, Jenna.
Thank you. Bye.
Bye now.